Good morning. Welcome to the Community Voice. I'm Steve Gradick, your host. Delighted to have you with us this morning. And we're on Facebook Live, we think. And everything's good. And everything's really good, actually, because it's a Monday. And it's a beautiful day. No thunderstorms, no tornadoes, which in our business is like, oh, no, not again. And we're honored to have in studio Marcy Sanders Heath of Insurance Solutions. Good morning.
Good morning.
Well, let me give you my little intro. You and I have met here every year, I think twice, a couple of years.
Yes.
Ever since 2009 to sound the alarm over Obamacare. In 2010, 7 long years ago, we predicted Obamacare would collapse in this year, and the idea would be that the next president would move us into single-payer socialized medicine. We were right about the collapse, but we did not know who the next president would be. And I don't think anybody did other than Donald J. Trump.
Correct.
You would have thought the Republican-led House, who voted even last year at 239 out of 246 for full repeal, would have voted for full repeal now. But we have, assuming the Senate passes a similar version, a Republican government-run health care through regulations and subsidies. Full repeal would have allowed the free market through innovation and competition to restore our sluggish economy dragged down by Obamacare. So, if a similar version passes the Senate and is signed by President Trump, the framework put in place by Obamacare starting on Christmas Eve 2009, I believe it was, will lead us most assuredly to single-payer socialized medicine. So, we're going to jump in and get into the details of H.R. 1628, the American Health Care Act. And we all understand that there'll be a similar version in the Senate, and it's quite possible the Senate will not vote it out because we have Paul, Cruz, and Lee who are adamantly opposed. But before we jump into that, tell us where we are in actuality, because you're on the front lines day after day after day, weekend after weekend. Working on Obamacare, and so what are you finding on the front lines? What's it like now in terms of subsidies, options, premiums, deductibles?
So basically where we are now, for 2017, we are basically down to, for the West Georgia area, down to 2 carriers. If you use the Rome doctors, then you can enroll in Allied. But if you live in the Haralson-Carroll area, you cannot use Tanner. So basically, if you live in Haralson County and you use Tanner, your only option is Blue Cross and Blue Shoulder, Georgia.
Meaning we have one insurance provider.
We have one insurance carrier.
And we're not the only area. Several states across the nation are understanding there are even states that don't have even that.
That is correct. So, so we're down to one carrier for 2017, and what people kind of don't understand is that is also in the marketplace. So if you go through the marketplace and you get a premium tax credit to assist with your premium, that's also the case if you go off marketplace. Let's say that you don't want any assistance at all whatsoever with the government, you still only have one option. And the plans are kind of similar. The only option that you have outside of the marketplace is you can get like the POS, the point of service plans, which are not offered in the marketplace. But we're still down to just one carrier. And I know that there was kind of some buzz last year when I went to a Blue Cross and Blue Shield meeting, that they were going to basically base their numbers, and that there was a probability that they might not even offer plans in 2018. So if that's the case, then we'll be left with no insurance carrier, because Humana, of course, left the market for 2017. They were only available in 8 counties in Georgia. For 2018, they are going away totally for individual carriers.
So what do stations, I understand it's like 34 counties out of 39 in Iowa, and I think East Tennessee, et cetera, that don't have an insurance carrier. What do they do?
So basically, they either have to get like a short-term policy, or they
don't have health insurance.
They don't have health insurance.
Okay, all right. Well, let's with that recap, let's take a break, and we're going to be back, and we'll get into detail into H.R. 1628, the American Health Care Act, which passed U.S. House late last week. First, but this word from Tanner Health System.
Need help finding something healthy to eat? Tanner Health System has an app for that. Minuit helps you find healthy food options on the go. The smartphone app is powered by Tanner's health experts, who teamed up with restaurants across West Georgia to make it easier for you to choose healthy food and eat better. Minuit acts like your personal nutrition assistant, showing you the healthiest items on the menu. So when you're not sure what's good to eat, Minuit. You can even use the app to look up recipes and plan healthy meals at home, and modify your options based on nutritional preferences, such as a low-sodium or vegetarian diet. Minuit and Tanner Health System, making it easier to eat healthy and live well. A healthier lifestyle is only a fingertip away. Minuit is free to download on your Apple or Android smartphone. You can download it today by searching Minuit in the App Store or on Google Play. Learn more about Minuit at gethealthylivewell.org.
Good morning. Welcome back to the Community Voice. I'm Steve Gradick, your host, and I'm delighted to have you with us this morning. We're pleased to have in studio Marcy Sanders Heath of Insurance Solutions. Our phone number is 678-601-TALK, 678-618-8255, or I can, looks like we can take maybe comments from Facebook Live, which we're on. I'd like to do a shout out to a good friend, John Jackson Jr., who has a great T-shirt that I'm proud to wear, even when I get in trouble. All right, H.R. 1628, the American Health Care Act. Will this plan lower premiums and deductibles, in your opinion?
I think that it will. It's, of course, just like Obamacare, took time to implement and to get kind of settled. Anytime that you pass a law with such magnitude, it's going to take a little time for it to kind of trickle down. So let's say that the Senate does pass it and it becomes law come January the 1st. Of course, insurance carriers, it's hard for them to know how to rate for that because they don't know kind of what to expect. So they may price it a little high for the first year until they kind of figure out like what the market's going to bring them. They don't know if the younger is going to enroll. Under Obamacare, it was promised that with the penalties, the tax penalties, that it was going to force the younger people to enroll.
And they were going to pay for everything.
Correct.
And they didn't enroll.
They didn't enroll. So therefore, you had the older people that enrolled, and then of course the people that were not able to purchase insurance, that had medical issues, that enrolled. So you had a larger, older, kind of sicker population. So I think that it'll take a little bit of time to kind of figure out like where the market's going to be, and over time it will lower the price and your out-of-pocket costs.
I'm going to read a couple of excerpts throughout this program from Tom Gray's representative, 14th District. And he says, and you know you've heard this, we've all heard this, that this strategy has three concurrent phases. Well, Representative Gray says, number one, first phase, the American Health Care Act, which repeals Obamacare's taxes and mandates and replaces them with expanded health savings accounts and age-based tax credit to help low and middle-income families in the individual market purchase health insurance. Additionally, the bill makes significant reforms to Medicaid, such as allowing states to receive federal funds through block grants and pursue work requirements for able-bodied adults without dependents. How's that sound to you? We're talking about expanded health savings accounts, age-based tax credits. Is that a good first strategy on this?
So basically what the bill does is, which of course Georgia was one of the states that did not expand the Medicaid, but you did have a lot of states that expanded Medicaid. And what that did was that allowed individuals that was under, I think, 133% of the poverty level And then I think they raised that in some states to be able to join in to the Medicaid system. So basically what this bill does is it freezes. It's going to freeze enrollment for the Medicaid expansion. The people that did enroll during the Obamacare, era, will be grandfathered in, but they're going to basically take Medicare back to what it's intended to do, and that is, to be available for people with income circumstances. And then, of course, as far as the HSA, it increases the HSA limits and allows spouses catch-up payments for certain expenses incurred prior to the establishment of HSAs. Which, of course, we all know that HSAs is a great tool for high deductible plans, and can be a great tool to be able to save money on top of pay your premiums and pay your deductibles and your co-pays with tax-deferred money.
So again, back to Graves, he says it increases the contributions for health savings accounts. In 2017, those levels would be equal to $6,550 for individuals, up from $3,400, and $13,100 for families, up from $6,750, and allow spouses who are HSA eligible at age 55 or older to deposit their catch-up contributions into one HSA account. We don't hear as much about HSAs as we probably ought to. Mm-hmm. Can you give us a quick synopsis of how important they can be to one's overall health insurance strategy?
So the reason why HSAs are not really kind of a popular thing right now is just because the price is not really there. To be HSA qualified, it has to be a high deductible plan,
right.
And as of right now, it cannot have copays. So you cannot have a doctor copay and you cannot have drug copay. So it basically has to be a high deductible plan. So there's certain qualifications, that goes with being HSA qualified. Well, if the pricing structure is not any different from having a high deductible plan to having a $3,000 deductible with, loaded in with copays, why would one choose to go with an HSA plan unless you're a young, healthy person and you're looking for tax savings, or you're a business owner, you're healthy, you're looking for, tax savings?
Mm-hmm. One thing that hasn't been mentioned, which was always talked about during the campaigns, which was the ability to buy health insurance across state lines. Mm-hmm. This legislation doesn't address that, does it?
No, it does not. And which I think is something that is going to be vital to, if this bill passes, I think that is something that Phase 2 needs to implement, because especially if this bill is going to restore and give the power back to the states. Here in Georgia, and let me see if I can explain this correctly, like in the individual market, your states is what basically kind of controls your price on your individual insurance plans. And the reason why they do that is because they have the mandates of what insurance carriers have to cover in their insurance policies. So as of right now, Georgia, I believe, has 6 mandates. Alabama has 2. So if I lived in Alabama, I could purchase an Alabama insurance policy half the price of what I could purchase a Georgia policy for. So the mandates that are basically in the Georgia insurance plans that are mandated by the state of Georgia that they have to cover, if I don't need those mandates, then I should be able to go over to Alabama and purchase a plan that's going to suit my needs. But as of right now, I can't do that.
And those are like the observed, I have to buy insurance for when I get pregnant type things.
Right.
Okay. That's really disappointing, though, isn't it?
Yes.
You would think that would be a huge, the Republican-led Congress would jump all over that.
Mm-hmm. which now I will give the state of Georgia, props and credit, because a couple of years ago they did pass that, to where, to where Georgia could, cross state lines to buy insurance. But you have to have, just the state of Georgia allowing that. If you don't have your, surrounding states doing that, then it's really no good.
Okay. All right. Let's, because Tam's going to get away from us if we don't. Let's jump into one of the hot topics surrounding this. It's getting a whole lot of mainstream media coverage, and that's pre-existing conditions. Tell us about what's the truth behind that. What was it like on Obamacare, and does this really change it that much?
Okay, so basically, so no, it does not, and that's kind of the wrong information that's getting passed out there. It's like, oh, you see it across the news and across Facebook and everybody's talking about it. It's like, oh, I'm not going to be covered for this pre-existing condition, and that is not true. That is false. The MacArthur Amendment maintains protections for pre-existing conditions. It's going to give you guaranteed issue and guaranteed renewability of coverage. So all of your protections remain law. So basically what the MacArthur Amendment does is it allows states to seek a limited waiver to allow insurance carriers to charge a higher premium for a person in the individual market with a health condition only if they do not maintain continuous coverage. A 30% surcharge if you have more than a 63-day gap in coverage. So if I was on a group insurance plan and I lost my job, retired, whatever, lost insurance, I have 63 days to access other coverage and I'm fine. If I wait 6 months and go, oh, I need to get coverage, well then yes, I'm going to be charged a 30% surcharge for allowing myself to go more than 63 days of not obtaining other coverage. Now, the 30% surcharge will only be charged to you for a year, for 12 months. Once you have that 12 months of coverage up under your belt, the surcharge goes away and you're only charged the premium as everybody else is. So the $8 billion that they're putting in the pool for the high-risk pools, that is the money that the federal government is setting aside to the states that opt in to the waivers to help with those individuals that chose to go without coverage for 63 days or longer than 63 days to help them with their premium and their out-of-pocket cost. Now, in the Medicare world, the people that turn 65, they have 3 months prior to turning 65 and 3 months after turning 65 to enroll into a Medicare supplement, Medicare Advantage, whatever they want to do, and that's their guaranteed issue period. If they wait longer than that time, then they have to go through full medical underwriting and can be charged more for their medical conditions. So the same thing has been going on in the 65, the senior market for years, and it's worked.
Mm-hmm. Well, that's fascinating, but it's still back to my original statement, and this is just kind of an aside. Philosophically, the federal government has got their hands now into all of this, right?
Well, not really, because they're returning it back to the states.
But the states has to get approval in one form or fashion if there's a modification to be made. So
well,
they're still looking to the federal government.
They are still looking to the federal government.
And, so the position of full repeal would be, we don't look to the federal government. It's completely up to the states. So this is not, from that point of view, this is not full repeal.
Right. So states can either opt in to, I guess, to seek for the waiver to allow insurance carriers to, to charge that 30% for individuals that, that go without coverage, or if they don't want to do that, then it would remain the same as it is now under the Obamacare stuff.
Let me switch gears because this is important too, and back to Tom Graves' press release on his calls 3 concurrent phases regarding this current health care plan, the American Health Care Act. Number 2, according to Graves, administrative actions which Health and Human Secretary Tom Price will take to eliminate harmful regulations allow more choice and competition in the health insurance marketplace. You know, they're contending, Trump and everybody's contending, that Tom Price is going to undo a lot of this. And as you recall, in the Obamacare legislation, gave enormous power to the Secretary of Health and Human Services. I mean, it was just like, it's not Congress really, it's HHS that's doing a lot of this. I don't understand how Tom Price is going to undo it. He can modify certain aspects and remove certain aspects, but I don't see that, again, phase 2 undoes Obamacare.
So basically, I guess where he's coming in, that they're going to undo Obamacare, is that they're basically kind of defunding some of the mechanisms that funded Obamacare. Some of the taxes, like they repeal the ACA tax credit in 2020. They repeal the small business tax credit. It delays the Cadillac tax until 2025. It restores the over-the-counter drugs eligibility for HSA medical care expenses. It repeals tax increase on HSA non-qualified expenses. It basically repeals the tanning tax. It repeals the net investment tax. It repeals the health insurance tax, and it repeals the medical device tax. So it's basically pulling back all of those taxes.
But I mean, you understand my point.
Yes.
Is that if in 4 years we have a new president and a new Congress, poof, there it is. It's right back in our face.
Right.
Including the tanning tax. Which I think was 10% or something like that.
Yeah, something like that. I'm not really sure.
All right, our guest this morning is Marcy Sanders Heath, Insurance Solutions. We come in once a year and we give you an update on health insurance across America, and it hasn't looked good in the last decade or so, but we'll keep after it. And we'll be back with more after this word from Tanner Health System.
In sports, when you play to win, you get your game on. Shouldn't the same be true when it comes to your health? At Tanner Health System, we're going to help you get your healthy on. Tanner is leading the way for you to eat better, get fit, manage or prevent diabetes, and live tobacco-free, so you and your family can get your healthy on every day. It all starts at gethealthylivewell.org. Check out upcoming healthy living events and join others in the community taking action to live well every day. GetHealthyLiveWell.org. Tanner Health System's way of helping you get your healthy on.
Need motivation and support to eat healthier, become more physically active, or quit tobacco? Tanner offers free classes to help you get your healthy on. Register today by calling 770-214-CARE. That's 770-214-CARE. Learn more at gethealthylivewell.org.
Good morning. Welcome back to the Community Voice. I'm Steve Grady, your host. We have Marcy Sanders Heath of Insurance Solutions here, and we're talking about health insurance, of course. And before we jump into another topic, eat healthy, live well. You know, we all need to be healthy.
Correct.
But now, isn't the person that doesn't have good health habits, that hasn't bought insurance, maybe spent money on other things, and vacations, second home, whatever, and they've allowed themselves to get sick. You know, they're eating bad diet, they're overweight, they're smoking 2 packs a day, and wouldn't it be? And then they go in and they want insurance for their pre-existing conditions. Wouldn't that be similar to a person allowing his house to burn down, not getting insurance, and then walking into the insurance company and saying, "My house burned down. You need to help me pay to rebuild it." Is that
It's
fair?
kind of the same concept.
Same concept.
You know, and that was one of the major issues under the ACA, which was the Affordable Care Act, was that insurance carriers lost billions and billions of dollars, and it wasn't during the open enrollment enrollees, the people that were responsible, that went and took care of their insurance during the time allowed. It was those that went and purchased insurance off of open enrollment. And of course, 2014 was when the marketplace opened, and it took a while for Americans to realize, hey, I have to purchase insurance during this time. Americans are just kind of used to being able to go and purchase insurance anytime they want to. So the marketplace didn't really do a lot of check and balances. The only time that you were supposed to be able to purchase insurance through the marketplace outside of open enrollment, you had to have a qualified event. Qualified event was loss of coverage, marriage, divorce, having a baby, etc. So they didn't really do a lot of check and balances, so a lot of people kind of came flooding in. Well, of course, when do you buy insurance? When you need it. So that's where insurance carriers lost billions of dollars, was those people that came flooding in off of enrollment.
Tell us about the insurance carriers, and have they made a lot of money off Obamacare, and have they been subsidized? And just tell us about subsidies in general. There's only about 3 minutes left.
So insurance carriers have been subsidized, but once you look at how much risk that they have taken on, I mean, obviously they haven't been doing very well, because we're down to one insurance carrier.
Yeah, right.
And I think I heard last week Aetna's pulling out of another state.
Right.
So obviously they're not doing very well. But under the new plan that's being proposed,
American Health Care Act.
The American Health Care Act, we do have the subsidies that are going to be changed up a little bit. So for those earning under $75,000 or $150,000 for married couples and a modified adjusted gross income, get the same fixed amounts for their age groups. So under 30, you get $2,000 annually, increasing in 500 increments per decade in age, up to $4,000 annually for those 60 and older. The tax credits are capped at $14,000 per family, using the 5 oldest family members to calculate the amount. So that's kind of basically how they're going to do the tax credits. It's not going to be basically, based on every dollar, that you make, how Obamacare is now. The only thing that scares me about this right here for my older population, for my older consumers, is right now under the ACA, we are only you're only able to charge 3 times. So if I'm 22 and you're 64, then they can only charge a difference of 3 times. Okay. So let's say I'm 22 and you're 64, then, and I know you're not 64, but under this...
And you are 22.
Yeah, I wish.
Yeah, I know.
So under this bill that they have proposed, insurance carriers can now charge 5 times as more. Mm-hmm. So the prices will go up for the older, mm-hmm. but the premium tax credit's not going to be as rich as what it was.
Okay. Unfortunately, we're pretty much out of time. How do people get in touch with you if they need more information?
So I am located in Bremen, 200 Buchanan Street, and my telephone number is 770-537-5300.
So we've got several more years to deal with this.
Well, we have to see what the Senate's going to do now.
Okay. Yeah. Are you optimistic?
Not really.
Not really. No. Okay. Okay. Our guest this morning has been Marcy Sanders Heath of Insurance Solutions. This is our annual visit, and we may have to come back and do it twice this year after the Senate gets through and see how it goes. So we thank you for listening, and we invite you to tune in tomorrow when we'll have more on the Community Voice. Lori will be the host, and go out and make it a great day. You're in tune to WLBB Carrollton.